Tumor necrosis factor alpha is an important cytokine that triggers local containment of infection, but induces shock when released systemically. Inflammatory mediators also stimulate endothelial cells to express proteins that trigger blood clotting in the local small vessels, occluding them and cutting off blood flow. This can be important in preventing the pathogen from entering the bloodstream and spreading through the blood to organs all over the body. Instead, the fluid that has leaked into the tissue in the early phases carries the pathogen enclosed in phagocytic cells, especially dendritic cells, via the lymph to the regional lymph nodes, where an adaptive immune response can be initiated. The importance of TNF-alpha in the containment of local infection is illustrated by experiments in which rabbits were infected locally with a bacterium. Normally, the infection will be contained at the site of the inoculation. If, however, an injection of anti-TNF-alpha antibody is also given to block the action of TNF-alpha, the infection spreads via the blood to other organs. Once an infection spreads to the bloodstream, however, the same mechanisms by which TNF-alpha so effectively contains local infection instead become catastrophic. The presence of infection in the bloodstream, known as sepsis, is accompanied by the release of TNF-alpha by macrophages in the liver, spleen, and other sites. The systemic release of TNF-alpha causes vasodilation and loss of plasma volume owing to increased vascular permeability, leading to shock. In septic shock, disseminated intravascular coagulation, blood clotting, is also triggered by TNF-alpha, leading to the generation of clots in many small vessels and the massive consumption of clotting proteins, thus causing the patient's ability to clot blood appropriately to be lost. This condition frequently leads to the failure of vital organs such as the kidneys, liver, heart, and lungs, which are quickly compromised by the failure of normal perfusion. Consequently, septic shock has a high mortality rate. And that's tumor necrosis factor alpha is an important cytokine that triggers local containment of infection, but induces shock when released systemically. Have a great day.